but usually they'll want to keep talking, and it almost always comes back to, well, you just believe the big man in the sky. And I always have to reorient them, and I say, look, you're the one who told me this is all science. We are not going to talk religion. I'm happy to talk religion. I will happily share with you where I come from, but what I'm trying to establish is what you call science is a religion. You are just as religious as I am. We just happen to believe different things. And honestly, my religion has far more science, facts, and whatnot behind it. And we can discuss that, but then we'll discuss it from a religious standpoint.
Hi, I'm Nathan Polatsky. Welcome back to Holy Hypocrites. My guest today is cardiologist Dr. Ross Pacini. And we talked about a lot of things. We talked about what sets apart a great doctor, what sets apart a Christian doctor. And then we settled on a really incredible conversation about the relationship between religion and science. And I exist in a world, I talk to a lot of people that would throw out science entirely for their faith. And Dr. Pacini talks to a lot of people who would throw out religion, throw out God and the supernatural entirely for science. And what we find in both cases is a misunderstanding of what science is and where God fits and how it all makes sense. And Dr. Pacini had a lot to share on that. He had a lot of brilliant input. I learned a lot. I think you will learn a lot from our conversation. As always, encourage you to subscribe, to like, and comment, and leave a review and all the things. But if nothing else, if you learn anything from this conversation, if you would share it with somebody, that would mean a lot. That would help these episodes land in front of the people who are going to get value from them. Thank you so much for watching, for listening, for engaging, participating. I hope you enjoy this conversation with Dr. Ross Pacini. Hi, welcome to Holy Hypocrites. I'm Nathan, and very excited to have our guest today, Dr. Ross Pacini. He's a cardiologist here in Nebraska, attended Creighton University, and did his residency at Emory. Ross, thanks for joining us.
Yeah, absolutely. Thank you.
Let me start you off with this. Why cardiology? Every doctor seems to have a story of how they ended up where they are.
Yeah, because I swore I would do anything but cardiology. So I come from a family of physicians, and my dad's actually a cardiologist. And so as a kid, I said, well, there's no way I'm going to be a doctor. And then I went to med school, and I said, well, there's no way I'm going to be a cardiologist. And then I became a cardiologist and said, there's no way I'm going back to my hometown. And I went back to my hometown. And so that's about how it happened. I just ended up really liking the subject material more than I thought I would. And it's a nice, rewarding field. There's a lot we can do for people.
So in the process of looking for some background information, there was one hospital that listed you as an invasive cardiologist.
Oh.
And I would love to know what that means.
Yeah, so cardiologist breaks down into non-invasive, invasive, interventional, and then something called EP. These are different subspecialties of cardiology. So invasive means I do some procedures. I'll do what's called heart catheterization. So we take a catheter, a long tube or wire, and run it either from the wrist or the leg up into the heart. We shoot some X-ray dye down those blood vessels looking for narrowings and blockages. Now, if folks need a stent, that's what I don't do, and that's what an interventional cardiologist does. And I do some other invasive procedures, something called transesophageal echo. So it's a slightly more procedure-based specialty than, say, non-invasive cardiology, where that's pretty much all seeing patients and doing imaging and whatnot.
So you don't do what every cardiologist on TV does, which is take the heart out of the body on every surgery, cut it into 3 or 4 pieces, sew it back together.
Yeah, so that's a common misconception. I'll happily endorse that misconception because everybody's like, "Oh, you're so cool," but no, those are heart surgeons. That's a totally different specialty.
I understand. Well, I'm going to ask one more question from the research, because this quote I found interesting. You had said on one of the websites that I was looking at, said, "I enjoy spending time with patients more than anything else." And that's another, I think, misconception about doctors, that doctors hate patients.
So where does that attitude come from?
Well, it depends on the doctor. There are some doctors that would rather see patients completely asleep and just be operating on or whatever they need to do and never really talk to them. And there are some specialties that way, but I certainly enjoy the interaction with people. I think I've always been relatively outgoing, and so I enjoy that aspect of it and trying to explain things to people. Don't get me wrong, it is nice sometimes when they're knocked out and you can just do what you need to do. But at the same time, it's nice to be able to talk to people and kind of go over things with them.
Yeah, of course. Okay, so kind of like to start off with every guest. How'd you meet Jesus?
I don't have some fascinating story. I wish that I did. It seems like every Christian I meet has this great moment, or they were walking a stray path and then here they are. But I was pretty much raised Christian and have never really thought anything differently. I was actually raised Lutheran, and so I got baptized at a very young age and went to a Lutheran church up until I met my wife, who was Baptist. And so we had to pick which direction we were going. And so we compromised on her winning and went to a non-denominational churches, which has worked out quite well, actually. And so I've never had that magic moment, if you will, that a lot of Baptists do. But I also feel like I have known Jesus since the day I was born and have never really fallen away. At least I hope not. And really feel like I've always been comfortable with my faith.
Well, and that's a good thing. I think sometimes I was just talking with another guest about how we feel the need sometimes to defend that as a testimony. Because you hear these powerful, like, I was doing bad things and then I met Jesus. We all want Paul on the road to Damascus and he sees a bright light, and it's actually a real blessing to get to grow up in that environment and, like you said, know Jesus from the beginning.
Oh, good. I'm glad to hear a minister tell me that.
What's something in Scripture that you have found applicable in your field?
I don't know if it's applicable in my field, but the verse I always go to in my mind is Romans 3:23. For all have sinned and fall short of the glory of God. I mean, I think that really dictates most of how I approach life. And so if you have a frustrating patient or a frustrating encounter with an individual, I have to remind myself, you know what, we're all sort of the same in God's eyes. And I can sit here and think, oh, can't believe he would do that. And I'm sure people could think that about me all the time. And so I try to keep that in mind when you have those frustrating interactions.
So what do you think is the fit as far as what's the response when you're interacting with somebody and that comes to mind of going, oh man, I'm a sinner too. You don't know what kind of day they're having. How do you respond in caring for them?
Silent prayer for them, and then depending on and myself, and then get out of the room as fast as I can. No, I'm kidding. No, I mean, I think I try to remember that all of us have our flaws and all of us have our problems, and I'll usually kind of take a deep breath and then I'll sometimes turn to them and say, hey, seems like we're not really connecting here. Is there something I've done wrong? And usually that'll quickly kind of turn things around and make it a little better.
What's one piece of advice if you could give every patient and every patient would take it and apply it? What piece of advice would you want to give every one of your patients?
Stop smoking, including marijuana.
Why is that the first thing?
Well, I mean, I say it a little tongue in cheek, but from what I do as a cardiologist, I mean, smoking is probably one of the most easily turned around risk factors, if you will, for heart disease. That and obesity are probably two of the biggest drivers. You can't change your genetics, but you can change those other things. And that's not to say either one of those things is easy. I mean, I get it. I get that. At the same time, if I was going to give somebody advice, at least from a cardiac standpoint, that's usually what I say. So patients ask a lot, what else should I be doing? And I say, well, don't take up smoking.
Helpful advice, I think, for all of us. Just
real
don't
unique advice out there. Yeah.
Well, if you just don't start the bad habit,
that's true.
I think a lot of us have those things. I get the munchies on occasion, and if I just
Mm-hmm.
didn't have it available, So,
Mm-hmm.
what in your mind, in your experience, separates a good doctor from a great doctor?
That's tough because I don't know where I fall in that category. Everybody likes to think they're a great doctor. Um, I think ultimately, if I had to pick, though, I would say it's got to be the right combination of knowledge and humility, because I've talked before with other physicians. The most dangerous doctor is somebody who lacks knowledge but has incredible confidence. That is probably the most dangerous combination. Where the best combination is has knowledge and doubts himself from time to time, because I think that's where you'll get the kind of doctor who's going to tell you, hey, look, I don't really know the answer to this, but here's what I think we ought to do. I mean, I think the dangerous doctor is, oh, yeah, here's exactly what we do. And they're just stone cold wrong, because I unfortunately have seen that. So I think it's the combination of those two things, probably.
And what's the benefit because speaking from the patient side,
Mm-hmm.
I always love a confident doctor because I just give the benefit of the doubt.
Mm-hmm, mm-hmm.
What is the benefit of humility, even in a really good, really educated doctor?
Yeah. Well, I mean, the short answer, you don't kill people. I mean, unfortunately, I mean, if you make the wrong decision, and there have been times we see this was clearly the wrong decision, and they were very confident about this decision, but it was clearly wrong. I mean, that's how people get hurt, and you can still hurt people with being right and whatnot. But what you don't want to do is look back and say, man, I was 100% wrong about that. And I told the family this is absolutely the right thing to do. So at least for me, and you're exactly right, some patients probably want the confident doctor to come in and say, look, I know exactly what's wrong. Here's what we're going to do. That's it. I tend to take the approach of, I try to spend more time telling people, here are the knowns and unknowns, at least from my standpoint. Here's what I don't know. Here are your two options. What do you think? And you're right, not every patient loves that, but my bias is I'd rather have had that discussion and done that rather than go forward and say I know exactly what's right. Having said that, it's sometimes nice just to not have to bother with that discussion and just say, hey, here's what we're doing.
Yep. So, can you look back? Is there a time that stands out where you were wrong and you caught it because of that humility?
Oh, I'm never wrong.
No, of course not. Hypothetically.
No, I mean, yeah, I certainly there have been like every doctor, and we never really want to talk about it. I have certainly made mistakes. I excuse me, fairly early in my career. It's a little hard to explain without giving you a whole long talk on certain aspects of cardiology, but we did what's called a cardioversion, where we convert somebody's heart back from a rhythm called atrial fibrillation back into normal rhythm. And we have to shock their heart to do that. And when we do that, there is a little bit of an associated stroke risk. And when the way we keep that as low as possible is to have them on a blood thinner for at least 3 weeks before we do that. And this patient came in, and I thought he was fairly low risk for an event anyway. And we were going to shock him. And right before I pushed the button to shock him, I was flipping through my calendar because something didn't make sense. And I realized, oh, shoot, he's only been on this for 2.5 weeks. We're shy that extra few days. And I said, well, he's here. He's already sedated. He's already asleep. He's driven in from out of town. Do I stop this and redo it? And I said, no, I'll go ahead and do it. And something just felt wrong about it. And of course, he had a complication afterwards. Now, in my defense, truthfully, whether we had had 3 more days of blood thinner or not, that same thing almost certainly would have happened. But still, it's something that I knew. So I had a long talk with the family and him, and he actually did very well. He recovered fine from everything, but that still haunts me to this day. And he was very nice about it. And I freely told him, I said, look, this is on me. This is my fault. And that's one of the hardest things to do as a doctor, is admit fault and whatnot. But fortunately, he did okay. He didn't sue me. So
best case.
Yeah.
So let me ask you this, and I want to reroute us briefly because what you're talking about brings to mind the verse that sort of started this whole podcast journey. Is 1 Corinthians 10 says, "Therefore, whether you eat or drink or whatever you do, do it all to the glory of God."
Mm.
And speaking as somebody who barely passed high school biology and anatomy, I can't imagine, like, we have just been given different skill sets, which is good for all of your patients. But you clearly, God has given you something, and you've worked very, very hard to make the most of it. Where have you seen, whether in your training or in your practice, God's fingerprints on you as a doctor? Where have you seen God's design and things that God has given you making you the doctor that you are?
I mean, obviously that's a tough question. I think more what I see. So briefly to answer your question, and then I'm going to answer the question I want to answer.
Please.
is that for me personally, I think I like to think that God has guided each step in my career, obviously, but the biggest time for me from that standpoint was the move from Colorado to Nebraska. And I think you and I have discussed that a little bit, but I never planned to leave my first practice, which was a practice I basically inherited from my dad. And it was a huge struggle with the hospital that wanted to own us and wanted us out of town. And me and my wife, who was helping out as the office manager at that time, fought for a year to try to keep our practice going and alive and defeat this monstrosity that was this hospital. And all along, in retrospect now, I think a lot of that was God saying, you probably don't need to be here anymore, and I'm going to send you to Lincoln, Nebraska. Now, unlike, I've never thought that I've never had a moment, I should say, where I feel like God is specifically talking to me. I guess I'm always jealous of people who say, well, God told me this and God told me that. And sometimes cynically, I always feel like, well, what God told you seems to line up very conveniently with what you wanted. Because I didn't, I didn't want to move. I didn't want to leave. But we ended up leaving. And I will say, I feel like I found the nearly perfect, nothing's perfect, obviously, nearly perfect job. And I wake up happy every day here. My kids are happy. We have a great life here. And so that was probably the time when I felt God's hand more than anything else. And the way I felt God's hand was sort of a slap to the head. It was no, this is not where you're going to be. And we're going to make this miserable for a while, but it'll all be worth it in retrospect. Where I think I experience God's hand more is day to day with patients. And I spend a lot of time reminding people and reminding myself that what I do is so minuscule and tinkering at the edge. And I tell patients all the time, they say, well, how long am I going to live? And I say, you have to ask God. Nobody but God can tell you. We cannot. Ultimately, God's in charge, obviously. I like to think that sometimes he uses physicians and other people to maybe help people extend their quality or quantity of life. But obviously, it's all in God's hands. And that's where I try to remind people everything we do is tinkering at the edge. And we're ultimately fighting a losing battle. We are all going to die.
Yeah, absolutely. So I love that relationship between medicine and miracles. And I know that's a complicated one in certainly some denominations more than others. What do you see as a doctor? What would you tell people as a doctor who are debating between this? Well, I'm going to pray for healing, but I'm also going to go seek medical help.
Sure. So I always quote a joke that my minister told when I was a kid, and I can't remember exactly how it goes, but I'm sure you've heard it, which is basically there's a man stuck out in a bad snowstorm and bad rain, and he's clearly in trouble and needs to get out of the cold. And so he starts praying, and a car comes by and says, "Sir, can I help you?" And no, God's going to take care of me. I'm praying. And then a bus comes by and says, "Sir, you need to get out of the cold. Can I help you?" And he says, no, God's going to take care of me. I'm praying about it. And then a fireman comes by and says, "Sir, we can get you home. We can get you out of here." No, it's okay. God's going to take care of me. And eventually the guy dies and he's in heaven and meets St. Peter at the pearly gates. And he says, "I don't get it. I prayed and prayed and prayed. Why didn't you save me?" said, are you kidding? I sent a car, I sent a bus, I sent a firefighter. What else did you want from me? And that's the way I view medicine. I don't think that I think that God uses all kinds of forms to help people. And sometimes the miracle is modern medicine, and sometimes the miracle happens despite modern medicine. But I think you have to be open to the idea that God can do things supernaturally, but he can also do them naturally.
Yeah, absolutely. So that relationship kind of brings us perfectly to the next question. We talked about good versus great. What do you see, or what have you seen, is the difference between a good or even a great doctor and one who is a Christian, one who brings faith along with the skills that they have?
Oh, all the great doctors are Christian. No, I wish it worked that way.
Yeah.
No, I mean, I think being a Christian probably dictates some humility to doctors. I think in the same way that I really respect what George Washington did when establishing the country, and he recognized there was a higher power, and he gave up power to say, I'm not going to be king for life. By the same token, I think doctors who recognize that, hey, look, I'm not the end all be all, I'm not God, really helps with the humility factor.
Yeah, absolutely. What does that look like day to day interacting with coworkers? Because we talked a little bit about patients and how you approach those relationships. Where do you have opportunities maybe to reflect Christ to the doctors and nurses and other staff that you work with?
I think that is more like all things, and there's nothing special about being a doctor. It's just how you portray yourself to your coworkers in general, what kind of life you live, what kind of language you use, where you clearly make your priorities. I mean, I think those things are all important regardless of what you do. I do think we have a unique ability with patients. And that's where I have a lot of lines that I don't even realize I'm using, but I will invoke God into things that I tell patients. God decides, and look, this is your God-given pacemaker. And it didn't mean a whole lot to me, although I've had a couple patients tell me that they really appreciated that. And then I realized a little more, and I was quoting something that I say to patients to a retired cardiologist, and he really balked when I said God. I could see it on his face, and he was just stunned. He said, "Well, I don't know if I would say that." And I'm like, geez. So it is. I mean, sometimes I think you don't even realize it when you're interacting with other people that I try to make it flow naturally. I've always hoped that I could one day have this moment where I'm the one who converted somebody to Christianity, and I think we all get nervous about that, and I have no idea how to do that. And so I think what I try to do is more implicit, to say, look, even doctors can be Christians, and to give people the hope that those of us who went to a lot of school aren't all crazy atheists.
I want to pause on something you said about making it flow, and about we all want to be the person to convert somebody. Something that's come up actually a lot in these conversations as we're getting into them is that those opportunities to plant seeds, and opportunities of saying, maybe, we all want to be the one harvesting. But I use this story again. Pastors are especially bad at this. There was one year where I had a bunch of students that I'd been working with that were growing, and they all went to camp and got baptized. And it was great and a little bit infuriating.
Yeah,
because we all want to be the one, doing that. And so kind of a reoccurring question that's come up with these conversations is, and you talked a little bit about working it into the things that you're saying to patients. Where else over course of time are you getting to show what Jesus is like, even if you don't get those chances to share what Jesus is like?
I think a lot of it's around end of life discussion. And I've gotten a little more comfortable asking people vaguely or in passing where their faith is, because I'll tell you, it makes the end of life discussion much, much easier. Patients who say, oh yeah, I know where I'm going. That's a very easy discussion with them. The patients that I've seen really struggle with end of life are the non-Christians. And a lot of them really struggle with the idea of death. We all struggle with the idea of death, but the conversations with patients and families are much, much easier with a Christian believer than they are with a non-believer. In terms of how I reflect things, again, I don't know. I don't know if I do that well or not. I try to make it clear where I stand. At the same time, I don't want to come off as preachy in the medical setting. Not that I'm opposed to it, but I don't know if that's the right venue to get to people. So I take a more roundabout approach to just make it clear, look, I'm a believer, and at least open up that door. So if people want to discuss from that perspective, then I happily will, obviously.
Yeah, that's an ongoing theme that's come up. I was talked to a cop and a public school teacher recently that both said, I'm not really in a place that it's appropriate to proselytize, maybe the word, but
true.
Certainly making those opportunities available. How, and this is maybe more so a curiosity, did you get training on those end of life conversations, or have you had to learn from experience?
Much more the latter. In med school, they have these fake patient encounters where you're supposed to. I can't even remember exactly what the scenarios are every time. Some of them are supposed to be difficult news, but you're doing it with a fake patient with 30 other people watching you, so it's a little bit arbitrary. It's not real until you do it in real life. I certainly think I've gotten better at that over the years, and can focus the conversation a little better. There actually is a whole specialty of medicine called palliative care where they focus on kind of end of life discussions, and most of us defer to those folks to have the discussions. I actually don't mind having them, and I think I do them okay. So I'll usually start that conversation and end it with, and now I'll have the palliative care team come see you. And that's helpful for the palliative care team if the physician has actually said.
Yeah. That's something I can't imagine. Again, most of the people that I get to have those kind of conversations with, they're the easy kind. They're the I know where I'm going kind.
Sure.
Getting to talk to some families that preparing for a funeral and saying, "Hey, we know where they are." Those are much easier conversations.
That's still not easy. I mean, you have to deal with a lot of death too, I'm sure. Yeah. I had a learning experience with pronouncing people dead. That was a moonlighting job I had, was to do the in-house doctor at night, and it was fairly cush because most of what we did was either pronounce people dead or deal with really, really sick people on a fairly urgent basis. But it was a fairly chill thing. And I remember getting woken up at 2 a.m. Oh, so and so has passed away. Can you come pronounce them dead? And I said, sure. And I wanted to stay a little bit asleep. It sounds crass, but it was an expected death, I should say. And so I didn't want to wake up fully so that I could go back to bed. I had a long day the next day, and I went in to pronounce the patient. The way we do that is we kind of listen for heart and lung sounds, and then I'll usually do what's called the sternal rub. We kind of push real hard on their chest. That actually is fairly painful. I went to go do that, and as I did, I pushed down, and the guy goes, and let me tell you, I was fully awake after that. And I jumped and panicked, and then I realized what had happened was there was still some air in the lungs, and I had kind of forced it out. And so, so we've all had sort of morbid experiences with death.
Yeah, absolutely. So I told you I wanted to circle back on the science and God thing, because it's something my students have asked about before. It's conversations I've had from the clergy side, is having to defend science. I interact with a lot of students and some parents that swing, I think, too far the other way, as far as saying, "We'll just throw out science. It's all God. It's all faith. Period." What have you seen from the science side that supports faith and that supports Scripture even?
Yeah. Well, I'm actually glad to hear you say that because I that's always how I open these conversations is I get frustrated on both sides. I get frustrated from a Christian perspective for exactly what you hear. Oh, I don't believe in any of that science stuff. And yes, it's all God. And yes, God created science. And I think a lot of times God works within science, as we talked about earlier. I mean, I think God uses doctors to heal people that wouldn't otherwise be healed. So I think there is a happy medium here. Obviously, what I deal with day in, day out are people who roll their eyes at religion. It's all science, it's all science, which is equally silly to me. I mean, first of all, it's such an easy argument to defeat, but uh, the simplest thing to discuss with people is, well, okay, let's go back 100 years and talk science. And for example, there's a very famous story in medicine. I don't know if I've told you this before, but about a guy named Albert Semmelweis, who was an OB 150 years ago. And he had a radical idea that was very anti-science that actually got him kicked out of medicine. And his radical idea was to wash his hands in between delivering babies. And his patients obviously did dramatically better, but he was drummed out of medicine for being anti-science. And so when people tell me the science is settled or the science this, the science that, I mean, it's beyond give me a break. As in contradistinction, you have the Bible and Christ and God, which have never changed. They've been the same since day one. The stories don't change. The religion doesn't change. The belief doesn't change. What we need to do to go to heaven doesn't change. I mean, that is far more scientific, if you will, and established than anything that is so-called science today. I mean, things we know to be true today will be wrong in the future. That is 100% guaranteed from a scientific standpoint. The things we know about Christ today will not change 100 years into the future. So I think there has to be, both sides have to recognize how these things work. And I've, as you know, I gave a whole course on where I think science and religion meet, and that I think that there is a lot in science and history that clearly backs up what the Bible has told us.
So, how do we begin as Christians who believe in science? How do we begin to have those conversations, not argumentatively, not divisively, but in a healthy? I mean, they devolve really quickly, and and what I always like to say to students that get caught online is, you know what nobody has ever said in a Facebook comment section is, you know what, I think you're right.
That's very true.
That has been said 0 times. So how do we begin to have those conversations in a healthy way?
Yeah, I mean, that's tough. I mean, everything's going to be, I mean, obviously you do want to convince somebody of your position. My usual approach, I mean, my pet topic, if you will, is usually evolution, age of the earth, stuff like that. And my usual approach with non-Christians will be to say, well, look, let's leave my faith aside for a few minutes and let's just talk purely on a scientific level. And let me raise a few scientific objections to evolution. And I've had this conversation many times, and I usually get sort of shocked looks of things that these other scientific people can't answer. And they say, well, gosh, I've never really thought about that before. And if I can leave it there, that's great. If I just leave a seed of doubt in them, that's great. But usually they'll want to keep talking, and it almost always comes back to, well, you just believe the big man in the sky. And I always have to reorient them. And I say, look, you're the one who told me this is all science. We are not going to talk religion. I'm happy to talk religion. I will happily share with you where I come from. But what I'm trying to establish is what you call science is a religion. You are just as religious as I am. We just happen to believe different things. And honestly, my religion has far more science, facts, and whatnot behind it. We can discuss that, but then we'll discuss it from a religious standpoint. Now let's establish what you believe is a religion. Now, if you want to have a comparative religions discussion, let's do that.
Yeah, those are very delicate, I have found, conversations, because scientists are just as radical about their faith, their religion, the real hard science people as Christians are about theirs.
Of course, and that's the reality. See, if it was truly a scientific discussion, they wouldn't be morally offended, because they would. You have to have the intellectual honesty to know science. Like we talked about earlier, science is wrong. So-called science is wrong a lot of the time, and that's how we progress, and that's how we have to have our ideas challenged. Albert Einstein said that, I believe. I mean, all these things are important, but when they react so viscerally and angrily, it's so clear to me that they're treating it as a religion.
One of my favorite lines on that is from a very scientifically accurate movie, Men in Black. When they're sitting on the bench and he says, so and so 100 years ago, everybody knew the Earth was flat,
Yep.
and so and so decades ago, everybody knew the Earth was the center of the universe. Imagine what we'll know tomorrow.
And in 5 minutes ago, you knew there were no aliens. Yeah.
You knew we were alone on the
alone in the universe. That's what it was. Yeah.
There's so much value and truth in that, of holding our beliefs loosely. I mean, we even get, and this gets a little bit to my pet peeves, is you get pastors together and they start arguing theology. And you'll talk to a guy who's absolutely 100% convinced that the rapture is going to happen, and one day we're going to be gone. And you get another guy in the room who's absolutely convinced that the church is going to go through the tribulation. And they hold those beliefs so tight that, again, you're speaking to someone's almost identity when you start to ask those questions.
Yeah.
So
that's absolutely true.
Those are really, really valuable. My next question, and one of my last questions for you, is, what are you in terms of glorifying God with your career? What are you working on? Where would you like to progress in doing that?
Well, I'd like to progress in general at being better at talking to people about Christ, not so much in the context of my job. I don't necessarily, I mean, is it appropriate from a Christian standpoint? Absolutely. Is it appropriate from a professional standpoint? And is it really going to accomplish the goals I want to accomplish? No.
Right.
So I would like to be better at proselytizing more in my outside work life than my work life. I mean, we're always looking to improve. I spend a lot of time praying. I pray for patients. I actually spend I try to pray before every procedure I do, God, please let this go well. Actually, I met a surgeon. He was my patient, who told me he prayed before every single surgery. And that's how I try to approach that, because obviously I'm fallible. And as I say, everything's in God's hands. And I really could use his guiding hand in everything I do.
Is it true that doctors are the worst patients?
Yes and no. Doctors are hit or miss as patients, actually. I always panic when I'm going to be seeing a doctor, because I always want to know, how much do they know? And I mean, if it's not their specialty, they'll usually defer to me a lot. The person I don't want to take care of is another cardiologist. That's a tremendous amount of pressure, because they're going to have their own ideas and whatnot. Most doctors I've taken care of have been great, actually. And in some ways, it makes it a lot easier, because you can use a lot of fancy medical words and kind of skip to the end, and they know where you're coming from, and you don't get a whole lot of pushback. So they're not too much of a challenge, but I have no interest in taking care of another cardiologist.
Fair enough. What have you learned about, again, I want to word this correctly. What has being a Christian professional taught you or shown you about being a Christian husband and father?
I think that's a good question. I have to think about that, but I think it comes back mostly to humility, and recognizing that I'm not God. I'm not going to always be right. My wife will tell you that is definitely true, and I have to learn that a lot, and I have to learn to say I'm sorry, just like I've had to tell patients in the past I'm sorry. I have to tell my wife I'm sorry.
Is there anything misunderstood? This came up, actually, one of the other interviews I did. He kind of stopped me and brought this up, saying, hey, people think X when in reality Y. What is misunderstood about doctors and about Christian doctors?
I mean, there's a lot. I think there's a lot misunderstood about doctors. I think people err on both sides. People err thinking that we are God and that we can fix everything and we know everything. And I think people err on the other side, assuming that we know nothing and we're basically there as proceduralists. Um, and I get a little more frustrated with the latter when people come in and they're very upset or they're very challenging and they say, well, I've done my research, which always kind of makes me laugh. And I said, okay, you got on the internet and found what you wanted. That's not really what I would call research. And, I say, well, I've done my research and this drug you gave me, it turns out is really, really bad. And it always annoys me because it's like, so you're assuming that I purposely put you on something that's going to kill you, and but for your internet sleuthing, you would have died from what I was doing. And that's always a frustrating conversation. I mean, I'm not there to put you on anything I think is going to hurt you. I'm well aware of what's out there, side effects and whatnot, and so I always find that frustrating, and it's fine. I encourage people sometimes to go home and Google certain things because I can only explain so much, but I'll give them the medical term and here's what I want you to look at and here's what I want you to read about. But I'll also tell them don't panic because you're going to read such and such about this and that. And so I find that frustrating. I find people wanting a quote unquote natural solution frustrating. It's like, I went to school to be an allopathic Western medicine doctor. If you want a quote unquote natural solution, there's naturopaths out there. And I always joke to people, they'll when they're having their heart attack at 3 a.m, they are definitely coming to me. But then when I tell them how to prevent another heart attack, oh, I want a different solution. And I say, well, that's fine. Next time you're having chest pain at 3 a.m, you go bang down the door of Vitamin Cottage and ask them what to do. So
I'm sure that's brilliantly received.
Yes. Well, I try to put it a little nicer than that, but it is. I mean, it does make the point too that look, this is what I do, and if you don't like what I do, that's okay. You don't. And I tell people all the time. I used to take it much more. I take much more offense to it, and I used to struggle with how to have this conversation with patients. I've gotten much more nuance to where I don't think I'm offending them, but I'll tell them, look, this is all I can offer you. This and this and this is what I do. And if you don't like those options and you want something else, like I'm not the right guy to see. Don't waste your time and money seeing me.
Yeah, it's a powerful, logical point, and one that I think there's some logic that we could all take away from that. What am I doing? I had a pastor mentor who used to say, belief drives behavior. And he said, you can say what you believe all day. But like you said, 3 a.m. having chest pain, you find out what you actually believe and what you're willing to put your life into.
For sure.
Last question, Ross, and I really appreciate your time. Is there anything recently that you want to recommend to anybody else listening? Could be a video or a book or a podcast or something that helps you glorify God with your life.
Gosh, you mean specifically in medicine?
Doesn't have to be in medicine. Can be anything you've interacted with recently that helps you or nudges you or reminded you of something that, oh man, God would like me to grow in that.
Wow, that's a good question. Nothing immediate comes to mind other than my favorite Christian ministry is always Answers in Genesis. And I encourage everybody who has questions about science and religion to look at what they have. They have a whole museum dedicated to creationism that is fascinating and scientific, yet also contains important Christian messages. Obviously, they also run the Ark Encounter, which is an incredible experience. Their website is amazing for people who have questions. Just typing those questions or that topic into the search bar will yield an incredible amount of scientific and religious answers for them. I absolutely love Answers in Genesis. I'd encourage anybody who likes the topic of medicine, of science and religion to check them out.
That's awesome. Is there anything I missed? Anything you're hoping that I would ask that I didn't ask? Anything you want to add before we close?
No, perfect, man. 100%. You're a stud.
Oh man, I am learning. Well, I am gonna stop the recording and a couple quick things before we get off the phone, all right?
Sure. Yeah, absolutely.
Great.